Hey guys, I'm Ericka Dixon, and today we're going to chat with gastroenterologist Dr. Whitehead. Come follow me. So can you tell me a little bit about yourself and how long you've been here at GBMC and just the basics of what you do?
So I'm Diana Whitehead. I'm one of the gastroenterologists here. I started in 2016 and I helped build the IBD Center, or Inflammatory Bowel Disease Center. It's a multidisciplinary approach in treating our patients with Crohn's and colitis. So ulcerative colitis and Crohn's disease, they are two entities that fall under the umbrella of inflammatory bowel disease. Ulcerative colitis only affects the colon. It's an inflammatory chronic condition. And then Crohn's disease affects anywhere from your mouth to your anus.
And with that, so I know some people have like a family history of these things, or some people can just develop it naturally. How would you say if there is any like a difference in how you treat either one, or just tell me a little bit more about that?
It's certainly genetic, so you can get it from your parents in terms of the genes.
And then for the treatments, how long do they last?
I mean, this is the time to be living for inflammatory bowel disease because we just have so many drugs coming out. There are oral agents where you take it, with medicines by mouth, and then there's certainly medications that we can inject. We also have a better technology on how to identify the disease. We know that there is an increased rise in it, and certainly our modalities have improved, including our colonoscopies and our imaging modalities.
So can you tell me a little bit about the symptoms with Crohn's and colitis?
Yeah, so we always have to make what we call a differential diagnosis. What could this be? Ulcerative colitis usually present with abdominal pain, rectal bleeding. Sometimes patients can have fevers. Crohn's tend to be more of like constipation, also diarrhea. It can be rectal bleeding or weight loss. So with that, I would like to show you one of our offices.
Sure.
This is where we usually see patients, and then we discuss their problems, and of course we sign them up for any procedures that they may need.
So can we switch gears and talk a little bit about colon cancer screening?
Yeah, so colon cancer, is the third leading cause of cancer death in the United States. Colonoscopy screening age has changed, as we know. It used to be 50 for the general population and 45 for African Americans. But now it's 45 for everybody, all comers.
So what made you get into this field?
I grew up in Ghana, and I moved to the United States when I was about 8 years old. And, I remember in Ghana, there was a problem with access to healthcare. And so even at that time, maybe I recognized that there was a problem with access of care. So that maybe subconsciously or consciously, that catapulted my interest in becoming a physician to actually help reduce disparity. I met a young girl who had Crohn's and colitis. Her quality of life was diminished. She couldn't do anything, and she was happy to see me. So that really made me realize the importance of representation, and also the fact that we will be able to change her quality of life. I think when we're sick, we're always vulnerable, and so that's what I love about medicine. You were able to help somebody and really improve their quality of life. And with Crohn's and colitis, you can really change somebody's life by treating them adequately.